2 more babies stricken with herpes after ritual ultra-Orthodox Jewish oral blood-sucking circumcision in New York City. The story goes, 2 more infants have been infected with the deadly herpes virus in the last 3 months after undergoing a controversial religious oral circumcision in New York City. The latest cases bring the count to 13 infants since 2000, 2 of which suffered brain damage and 2 died from the virus, which can rapidly spread through its body. The ultra-Orthodox Jewish practice of Metzah B'Peh requires a practitioner to orally suck the baby's penis to cleanse the open wound following its circumcision, making them susceptible to virus. The Department of Health says one of the latest infants to contract the virus developed a fever and a lesion on its scrotum 7 days after the procedure. The boy later tested positive for HSV-1. That virus differs from HSV-2, the genital herpes, which is contracted during sexual intercourse. A herpes infection in a newborn baby has a risk of leading to severe illness and death, states Deputy Commissioner of Disease Control at the New York City Department of Health and Mental Hygiene. The reason is that the baby doesn't have the same fully developed immune system as an adult. Instead of staying in the genital area, it extends through different organs in the body, he explained. He said it's too soon to tell whether the boy will suffer permanent effects. The identity of the rabbi who performed the circumcision is being withheld by the boy's parents, preventing the health department to step in, they said. The religious practice that dates back to more than 5,000 years defies warnings by the city's Department of Health, which says there is no safe way to perform the oral suction on an open wound. More modern Jewish practices use a sterile aspiration device to cleanse a wound or a pipette opposed to oral sucking. But some rabbis stand grounded behind the practice, calling it a religious freedom while noting its long history. In September, the department voted to require parents to sign forms consenting to the risk of the practice after the death of 2 children who contracted the virus through the practice. The parents of the newly infected boys are said to have not signed those forms. According to Rabbi David Zibel, Executive Vice President of the Orthodox Jewish Organization, Agadah Israel of America, 2/3 of boys born in New York City's Hasidic communities are circumcised in the oral suction manner. The health department states they've had complaints in the past by parents who say they weren't made aware that the oral practice would be performed on their child.